everybody. Welcome to Care Collaborators. I'm Anthony Salem, owner of Big Creek Massotherapy.
Dr. Tanya Yannick of Yannick PT.
So, Dr. Tanya, tell us, why should our viewing audience consider physical therapy as an option?
Okay. So often we have aches and pains, and we're kind of like, ugh, I don't know what to do with it. And sometimes for a while you stretch it a little bit. You go to people like you, massage therapist, which is great. But sometimes the stretching doesn't work, the massage doesn't work. Maybe it's getting worse. Maybe it's starting to affect things that you're able to do or want to do. Like suddenly you notice you're not walking the dog as much, or you can't go for that run, and it's affecting your life. Then you're like, oh gosh, maybe I need to go see a doctor. Maybe it's pills and surgery. So then we can, bring it back down and say, okay, what should I do next? Well, physical therapy is something you should consider because a good orthopedic physical therapist can assess from top to bottom. So you come in with a knee problem or a foot problem, we're not just going to look at the area that's affected. We're going to look at what may have caused it, get to the root of the problem, because a lot of times pain is the last domino in a domino chain effect. So I'm the investigator. I'm going to go back and see what were the other dominoes that caused that last domino to fall and cause you pain. We are able to assess very similarly to an orthopedic surgeon. We just can't obviously do the invasive, surgery injections, but we often do similar special tests. And a lot of times, I don't know if you've tried to get into an orthopedic physician or a GP or something, sometimes it takes forever. So contacting a physical therapist, a lot of times they can get you in quicker. And many people also complain about the time that you get with a physician. And most physical therapists have more time to give. So they have, a lot of them have doctorates now. And also we can assess just about as well as an orthopedic physician. So if you have that ankle pain and you're just like, oh, it's going to take me 2 months to get in to see that sports med doc that I like, and I want to, I have a marathon next month. You don't have time to wait 2 months to go in, and you're not going to be able to finish your race at that point. So it's a good, seeing a physical therapist is good because we can see you quicker. We have the knowledge to assess and figure out what's going on and get you back to doing what you love quicker. And ideally without any pills, without any surgery, because the opioid epidemic is an epidemic. So those that want to avoid that, or just as a whole, we're trying to keep people off of them as much as possible. Seeing someone that can offer holistic services that don't require medications. And a lot of times if you go in, or not a lot of times, but often if you go into a physician, sometimes they're going to say maybe you need surgery, and there's a lot of non-invasive options you have before that. So
Now I find that people think that physical therapy is for a traumatic injury or work injury or sports injury. That's not necessarily the case,
Nope.
correct?
Yes, that is correct. So that is kind of what most people think of, physical therapy, so you help the older people that break their hip, which is true. There are those people, but orthopedic physical therapists, such as myself, we are for any ache or pain. So that's, again, if you're thinking about going to the GP or going to the orthopedic physician, assuming that you don't believe it's broken, then you'd need an x-ray. But if you're like, I know it's not broken, but I have this ache and pain and everything I've been trying isn't working and I need to actually see a medical professional, that is when it's a good time to go see a physical therapist, because our goal is to keep people active without using pills or surgery, because we can't prescribe and we can't do surgery. So of course we're going to use everything in our knowledge base to help people without having to do that, obviously. So, and we are usually very successful because we are able to spend the time that most physicians can't. Not that they don't want to. So I hope I don't sound like I'm saying physicians are doing a bad job, but
No.
they only get so much time. That's just how their schedule is set up to treat the masses that they need to treat. We have the luxury of having more time with the people to really investigate top to bottom and talk to them about their history and talk to them about their goals. I mean, I could have 5 people come in with similar knee pain symptoms, and depending on their history and their goals and everything, it's going to be completely different. A sedentary, relatively sedentary 50-year-old that just wants to be able to walk their dog, which is very important, is going to be very different than, the 37-year-old that wants to finish a marathon next month and now has knee pain for some unknown reason.
Mm-hmm.
But it doesn't, I'm going to assess them per what their goals are. Do you want to be able to walk your dog, or are you trying to get to that marathon? And, physical therapists are able to, tailor those workouts or those treatments to what they need.
I can speak firsthand. Hip pain that I had in the front area of my hip because of a pelvic tilt that no matter how many massages I got, and of course I'm a proponent of massage therapy because it's what I do, but certain disorders can't be cured by one therapy, and this pain would come and go. So Dr. Tanya actually helped me with that. So I can speak firsthand to the value of Dr. Tanya and her knowledge and how she knows the body and can assess over your clothes. It's very, professional.
Yes.
It's so if you're getting one of those other therapies and you're not having the success, and I'll tell clients, hey, you need to talk to somebody else. You need to see another professional. Give Dr. Tanya a call. Because we want those people to get over the pain and get on with their lives. So it is best to do that instead of taking a pill. We're going to harp on the opioid thing probably a lot.
Yeah.
Because it is an epidemic, but hopefully not too much for you guys think we're being boring.
Yeah. And also, you even touched on it about doing massage preventatively. Same thing with PT. I've joked, and I've actually put this information out with, my businesses, with our teeth, we get our cleanings, ideally if we're doing it, as we should be, like, every 6 months to, up and at least once a year. But we don't do that with our bodies. So we do it with our teeth, but not our bodies. So, and why are we doing that? Like, we're waiting until we're falling apart and we're like, oh, I guess, there's no hope for me now. And it's like, well, let's stop that. Let's actually start taking care of yourself. So another thing that I actually do, I do fitness assessments. So I'm actually looking for those weak links, that domino chain effect I was talking about. I'm looking for those dominoes before all the dominoes have already fallen and you have that pain. So that's been really fun to do, is when people are like, well, I think I'm okay, but I'm training for, or I'm just increasing my activity, or I just want to stay healthy, because they, people don't want to end up, they see their family members, their older family members, or maybe some friends go down the wrong path. They, end up having surgery after surgery, and they're on medications, and now their, quality of life isn't great, and they're like, oh my God, I don't want to be that. We can actually head that off before it even gets to that point. Like, I can do a fitness assessment, making sure that any of those weak links that are going to lead to bigger problems can be taken care of, so that you don't end up in that spot. So I think that's PT in a nutshell. But
or if you slip on a nutshell.
Yeah,
hurt
come see me.
yourself.
Come see me. That'll work too. Yeah.
Yes.
I do also do injuries, and I have some other specialties as well, but that can be a whole, I do women's health, pelvic floor, but that'll be a whole different episode, because I could spend hours on that. That'll be a different episode.
So thanks for tuning in, everybody. We'll be back very soon with another health-related topic. Take care. Be healthy.
Yes. Stay well. Bye-bye.